there, and welcome to the Reflection Show with me, Martha and Spice. Today, we want to look at an amazing topic. Great conversation. Diabetes. Have you heard about diabetes? What did you hear about diabetes? Are you like me who just thinks that diabetes is caused by eating a lot of sugar? There are lots about diabetes that you and I do not know. Today, we want to make sure that all the myths and misconceptions about diabetes in your mind is taken away. We're having a conversation with qualified medical personnel who will be giving us accurate education on diabetes. Stay tuned. Let's delve into this conversation. I am Martha Spice. Growing up, it was so difficult finding answers to all the questions that bothered my young mind. As soon as I found my purpose and understood my mandate, I made it a mission to answer as many questions as possible bothering young people. I have mentored, inspired, and helped young people unearth their potentials through the Martha and Spice Foundation. However, I feel it is time to bring the conversation much closer to you. We have you in mind, you the young person. With my team of experts, we bring to you the Reflection Show, a show that focuses on addressing issues young people face, helping them to unearth their potentials, and giving them nothing but the best avenues in helping them solve issues that they may face in their young age. Join me, Martha and Spice, every Thursday and Saturday at 8:30 p.m. on Truth TV, the Reflection Show, restoring hopes. Welcome back from the break. Still here on the conversation on diabetes. I'll be speaking with Dr. Odalis Rivera. She's a physician consultant, and Dr. Abdul Mumin Cheltaba, also a medical officer, all at the Tamale Teaching Hospital. So this shows that, like I said earlier, we have the right and qualified medical personnel helping us to delve into this conversation. Thank you very much, Dr. Odalis, for joining us.
Thank you for having me. Thank you.
Yes, and Dr. Abdul Mumin, thank you for joining me.
It's a pleasure being here.
Okay, so let me start with Dr. Odalis. We've heard so much about diabetes. I think for me, this is actually the first time I'm even paying attention to diabetes. What is diabetes all about?
Well, diabetes is a chronic disease, and our body relates with a hormone that we call insulin. It's produced in the pancreas, one of our organs of the digestive system. And basically, what happens is that there is a deficit of insulin, like it happens in type 1 diabetes, or the peripheries are resistant. There is a insulin resistance at the peripheries. Then this will lead to hyperglycemia. I mean, the blood, the glucose in the blood will be elevated and will lead to different symptoms, or sometimes it's asymptomatic, but the most important aspect to look at is the chronic complications that can present in patients with diabetes.
Okay, so Dr. Abdul, let's look at in our layman's perspective. You are here.
Yeah.
What are some of the things you just hear we say diabetes is?
Okay, so there are varied things that people have said about diabetes, but that commonly you hear it in our local parlance, especially in the brand, it's a shikridro. And some say that's high blood sugar. So some people have related it to some other stuff that I can't really say a lot about. But commonly people say it's, I mean, shikridoro.
Yeah.
I mean, and they are not far from it because that's basically the
What it's
essence of
about.
what it is. Yeah. So having high blood sugar, the sugars in your blood are too high, so they are above what we consider as normal.
Normal, okay.
Yes,
okay.
and as she already mentioned, Dr. Dallas mentioned, at these high levels, it's detrimental to the body, and then you start to see complications as a result of the diabetes. Then that's how the chronic form of the diabetes presents.
What are the types of diabetes?
Well, we have what we call type 1 or insulin dependent diabetes. It appears mostly in children in the young ages. And it has different causes, basically autoimmune causes. And there is no insulin in the body to add at the peripheries to control the level of blood sugar. So those patients will depend solely on the use of insulin to keep the blood sugar
You
normal.
mentioned children.
Children, yes, children.
Wow.
They appears in the young ages. Sometimes the class they are more than that, okay, because they can appear in adults, but with various predisposing conditions. But basically, when we look at children presenting with diabetes, we say, okay, this is a type 1 diabetes or insulin dependent diabetes. When
Okay.
we say insulin dependent, means that they will need insulin to be free from symptoms
Okay.
and
Okay.
to control the levels of blood sugar. There is the type 2. There are many types, but basically I will mention the main.
Okay.
most
So the
important
main
one.
are just
The
two
main
types. Okay.
Three.
Three. Okay.
The type 2 diabetes is what it starts mostly during adulthood. We call it
Okay.
type 1, type 2, sorry, type 2, the diabetes mellitus. So for this one, is mostly there is a resistance, insulin resistant at the peripheries. Insulin resistant at the peripheries, and then the patient will sometimes will need insulin to control the blood sugar level, but we will prescribe oral medications for the type 2 diabetes, but in adulthood is where it presents the most.
Okay.
And then we have the gestational diabetes, is the one that presents during pregnancy. So during pregnancy, many changes occurs in the mother, and then can present with gestational diabetes. After delivery, maybe that patient or that mother does not develop the type 2 diabetes, but we need to keep an eye on those patients because of the gestational diabetes. Basically, those are the three main.
So in layman's perspective, 1, it's in children. 2, adults. 3, found more in pregnant women. Okay. So Dr. Abdul, so with these 3, I think you mentioned these are the common ones that we will see. I know there will be others, but let's take them one by one. The type 1, how is it?
So, as you mentioned, type 1 tends to be more in childhood and adolescence. So, remember when she was talking about how the disease begins, it is how it has to do with the deficiency in the production of that particular hormone, the insulin, which is key in the regulation of the blood sugars. And so, for some reason, genetically, those that particular organ, which is the pancreas, there's some defect in the formation of the organ, so it's not able to produce that insulin. So you tend to see it at a younger, because as they grow, then the organ grows, then you tend to see the function more. So they are at the risk of developing some complications, sometimes we refer to as diabetic ketoacidosis. And so that one has to do with because of the high sugars and the problems with metabolism, they can come with diverse forms of complications. But acutely, when we say acute, within a short period of time in terms of the more chronic complications. So acutely, they may come with severe dehydration, they may have some metabolic derangements, and it can cause loss of consciousness. They can even go into coma. That's what we refer commonly to as diabetic ketoacidotic coma. Right? So usually that's how that plays out. So you still tend to see these conditions. This particular one in the young children, then you tend to see these people at the diabetic clinic, very young child. You see, and mostly we treat that one with insulin because that one has to deal with absolute deficiency in the insulin more, right? But then the type 2 diabetes, which is commonly what we see because that's what's in the adults, the adulthood. As you mentioned earlier, that had to deal with what resistance. Resistance simply means that even though there's insulin, the tissues that are in the body that are supposed to take up the insulin are not responsive. Right? So the insulin is there, sometimes even in decreased amount, but they are there, but then the tissues are not. Yeah. So with the type 2 diabetes, it's multifactorial. Right? So there are risk factors to developing type 2 diabetes, which is more common in our setting. So it's multifactorial. It has to do with a strong family history. All right, so anybody in your family who has diabetes, especially a first-degree relative, all right, so either your parent or a sibling who has diabetes, that increases your risk of also getting diabetes.
Great.
All right, so a family history of diabetes increases your risk. On top of that, then we have a lot of lifestyle issues that have to come into play. And I'm sure as we delve in more, we talk about
Yeah.
certain lifestyle that tend to also compound or to even predispose you to getting the type 2 diabetes. All right. That's common in the diabetes. So then the gestational diabetes is the one we see common in pregnant women. So this is an otherwise healthy patient who has never been diagnosed of diabetes before, but gets pregnant, and then they pick up that she has a high blood sugars. Previously, she didn't
She
have,
didn't have that.
right? And then
Maybe
throughout
the baby has a lot of sugar.
yes. So they pick up during pregnancy and during the ANC, and when they are managing the pregnancy, they pick up and then they treat. All right. For some cases, after the pregnancy goes, then it resolves. But just having gestational diabetes also predisposes you to getting type 2 diabetes. So as I mentioned, some people progress with the gestational diabetes and develop type 2 diabetes, which is more chronic, or some have it resolved, only for it to appear later in life. So these are the dynamics within the common thread.
Okay.
we
Let me
have.
come back to you, doctor. What are the causes? What really causes or risk factors of diabetes?
Well, for the type 1, as Dr. Momin explained, it's just a complete deficiency at the level of the pancreas in producing insulin. But for various factors, mostly infections can cause destruction of the
Okay.
cells, and also autoimmune diseases. Autoimmune means that we don't have a clear condition causing the destruction of the cell,
Okay.
but it occurs.
Okay.
Then for the type 2, something that we need to look at, as he was mentioning, is the risk factors. So for me, screening is vital in diagnosing type 2 diabetes, because we have various presentations of diabetes, and it's one of them is, and very common, is asymptomatic diabetes. So we can be moving around with sometimes headache or without any symptom,
you don't
and
know.
you don't know. So you go for a screening. Let's say there is an outreach in your village, or there is, you decide, okay, this is my year, the year that I have to go for a checkup, and you realize that, oh,
I have
someone
diabetes.
informed you that your blood sugar is high. So for me, screening is vital in diagnosing the risk for developing diabetes. But there is a stage that we call pre-diabetes.
Okay.
So your blood sugar are not normal. I mean, the levels are above the normal range, but not at the range to say you are diabetic patient. So that stage is also really important, because it doesn't mean that you will be diabetic, but later, if you don't take care of the risk factors,
It's like a warning that is
exactly,
telling you.
exactly. So if someone tells you, oh, you are pre-diabetes, you have pre-diabetes, then that is a red flag, and that you should go for screening at least every 3 years, or you should work around the lifestyle, because lifestyle also takes a good part in the development of type 2 diabetes. So when we look at the other risk factors, he was mentioning the family history, first degree relative with diabetes, but also the obese patients. You know, most of the time we have a sedentary life. We go to work, we sit in offices, we go back home, we cook and go back to sit in front of the TV or go back to sleep. And then that is a risk factor. Another risk factor is the way we eat. I always say that we eat our chronic diseases because we eat a lot. We take a lot of carbohydrates. Very nice. If you look at the African dishes, very nice one, but I will say it very dangerous in terms of how they can cause predispose for you to develop diabetes, hypertension, or any other chronic diseases. Okay, and then other risk factors, other thing that we need to keep in mind related to the screening is the age. We consider, based on the guidelines, that every person, irrespective of the other risk factor, family history, if it's obese or any other risk factor, should be screened when you are 35 years or above. So just to be
should
in
be
the
screened
screen
for
diabetes.
diabetes. Okay.
Screen for diabetes, just to be in the safest.
Safer.
Or even before 35. 35 may be a bit too late. Or that is when
No,
the
it's
high risk starts.
when there are no symptoms.
Okay.
We are talking about the asymptomatic.
Okay,
one.
okay.
But when there are symptoms, of course, you have to go under. And if you are younger than 35 years, but you are obese or you are you have a sedentary life, you know that you eat a lot of carbohydrates, you consume a lot of salt, and this your in the case of the husbands, the wife are cooking those very nice meals with a lot of
Yeah.
so you can go and take the screen because it's easy. We have clinical points to say, okay, based on the risk factors, you can be developing diabetes. You are diabetic, or you are at the risk of developing
Yeah,
diabetes,
diabetes.
and then the blood samples that we take, and then we say, oh, based on your result and this level, the guidelines are saying that you are
Yeah.
not diabetic, you have pre-diabetes, or you are diabetes. Yes, so
Okay. So let's come to the symptoms
Okay.
of diabetes. How do I know whether from the early stages, late stages, what are some of the symptoms that will start for me to start, that for me to be like, okay, I have to start paying attention to diabetes?
Right. Okay, so in terms of the symptoms, I should mention majority of people with diabetes are asymptomatic. That means they don't have clear symptoms.
Of what?
Yes. So they are walking around without knowing that they have diabetes because, of course, diabetes is not like any other infectious disease like malaria that you think of a headache, fever, and all those things, and you say have diabetes. So at the early stages of diabetes, it's mostly asymptomatic. But as it progresses more, and then it tends to cause more complications. Then a common symptom you may find is what we call polyphagia. So for some reason, you have developed increased hunger, increased appetite. So you're eating more than you usually do. Your appetite has increased more than it usually does. And that sometimes also comes with what we call polyuria. So that one means increased frequency in urinating. Then you go urinate a lot compared to what you used to do. All right. And then increased thirst. So you become thirsty. Right? You become more thirsty than usual. So these three things are common ones. Aside that, the other things you tend to see is that when they start developing complications, then you get to see the symptoms of those complications of diabetes. All right, you can think about so many complications of diabetes. It's varied. It's so many. If I start talking now, I will start from the head, and then we'll move to the
Yeah.
toes, so we can talk about every single thing about it. The interesting thing about diabetes is that it has a high risk of causing cardiovascular disease. Right? So you're thinking of cardiovascular disease, you're thinking of heart, then the blood vessels, and the nerves. All right? So people who have cardiovascular disease, you're thinking of atherosclerosis. You've heard of atherosclerosis. That's what usually causes the narrowing of blood vessels. All right?
Okay.
So having diabetes predisposes you to get atherosclerosis. And as a result of that, you can have narrowing of your blood vessels. And if this blood vessel is going anywhere to the body, then that means that particular organ will be affected. So you can even think the earliest sign you also get is what? Eyes. Eyesight changes. All right. Something we call diabetic blurred vision.
Hey.
Yes, what we call diabetic retinopathy, because the blood vessels to the eye are the tiniest, and so little narrowing can damage that. So you can get eyesight changes. So that's why diabetic retinopathy. You can think of so many complications of diabetes, but typically the symptoms you have are the classic symptoms of increased thirst, increased hunger, increased frequency of urination are the ones that we say, oh, once you see these things, please get screened for diabetes.
Okay.
Right?
So let's narrow it down a bit to children.
To
So
children.
the type 1, what would the parents see, to know that I have to pay at, because children may not be able to listen and experience this, and maybe the symptoms may differ from the adults to the kids. So let's maybe children, what can we see, as parents to know that we have to pay attention to that?
Well, in children, the baby can present with the same symptoms, the urination, the increased urination, and sometimes because of the acute complication, irritability, or the child is losing weight without
Any issue,
any explanation, or the boy or the girl are getting infections frequently. Any kind of infection in the feet, or urine tract infection, or pneumonias, and then it's like getting sick often without any explanation. So when they go to the how you call it, to the lab, to the hospital, then we diagnose that the child has diabetes. Something that can also be children who has a high weight during birth. If you see, okay, the mother, we are happy, we have a bouncy baby boy, a bouncy baby girl,
Yeah.
very, So those children can also be predisposed to diabetes, or the mother, you can check the mother, and the mother can have a gestational diabetes. So it's one of the
The
expression
things
of,
that what would be the worst thing that would happen if not some, we encourage women to go to the hospitals while they are pregnant, but what if a woman doesn't go and it's not detected, or she even goes but it's not even detected, and she has a child who is diabetic? How do you manage the child and then the mother so that it doesn't get so serious?
well, always having a child that is sick is a challenge for the family, not only
Okay.
for the mother but for the family. And that child will depend solely on insulin for uh, for us to control the level of blood sugar.
Okay.
So if it's the small child, you can't counsel the child, but
Yes,
the
the
parents, the
parents you
family, the one who is taking care of the child about the disease. It's not something that, okay, sometimes you are scared because, oh, diabetes, we heard so many things about diabetes, but we should know that there is a drug, the insulin, that of course the child will be using it for life, but that drug will be helping him or her to control the level of blood sugar, to prevent complications. Because in children, as Dr. Bumi mentioned, the diabetic ketoacidosis is the most dangerous complication that can lead to the death of the
Yeah,
child. So we need to be aware of that. It's not only instructing them about, okay, this is the disease that your child is having, but to educating them
on
about
how to manage it.
everything, how to manage, how to cope with having a child that is sick. The child can have
A
quite a
normal
normal
life.
life.
Yeah.
Yes, it's not like it's going to prevent the child from playing or from going to school. No, 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 no. The child will
But
have
just
a
that
normal
extra
life.
care would be needed, especially with what they eat
Yeah.
and
Exactly. Yes,
ah.
exactly.
Does it affect also other health? Maybe is it also a risk factor for malaria and all those stuff? Like sometimes it affects other, should I say, sicknesses or illness? Is there is diabetes?
Okay, so as I mentioned earlier, diabetes has broad complications, and one of the complication, or one of the things that comes with it, is it reduces your immunity.
Yeah.
So reducing your immunity simply means that it's bringing down your body's defense mechanism. Right. So how your body is able to defend itself against infections and opportunistic infection is rather reduced as compared to if you had a normal level. All right. So your risk of under normal circumstances, you would have some level of defense against these common conditions we talk about. So you talk about urinary tract infections, pneumonias, and all those things. They are things that you can easily get infected with. So that's one of the things that you can look at. But on a broad view, there are other complications that it is associated with, right? One of the risk factors for stroke is diabetes, especially what we call ischemic stroke. Diabetes and hypertension are also strong risk factors for stroke.
Wow.
All right. So if you don't have very controlled sugars, or you don't have good control of your sugars, you're at risk of getting a stroke. Now, another one that is of concern to me, and I'm a bit passionate about it, is what we call chronic kidney disease or
Okay.
kidney failure. And we are seeing that
A
rise,
lot.
right? We are now seeing a lot of
A
kidney
lot.
failure. I mean, at the
Especially
teaching,
among young
people,
Exactly.
yes. So the renal clinic in TTH are overburdened with the numbers, right? And we are seeing a rise in the number of cases of kidney failure, chronic kidney disease. And worldwide, the number one cause of chronic kidney disease worldwide is diabetes, right? Diabetic nephropathy. So you see, diabetes has a strong relation with chronic kidney disease. We've talked about stroke, and we can even talk about the heart. So getting heart failure, getting acute coronary, so heart attack. Sometimes you remember heart attack. Remember mention of some atherosclerosis or narrowing. So blood vessels that supply your own heart can get narrowed, and you don't have enough blood going to your own heart, and then that can fail. And another common one we see, and that is the most glaring one because aesthetically it's not really appealing, is the foot ulcers. I don't know whether you have seen some people have
I said that one they said that if you have a sore, the sore
wooden heel.
wouldn't heal.
Yes.
Okay.
Like
okay.
can lead
I
to
remember.
amputations.
Amputations.
So yes.
Yes.
Oh,
So
why? Because of diabetes, sore finds it very difficult to heal.
yes.
Exactly.
Wow.
So there's a lot of factors that result in. I remember it also has to do with the narrowing of the blood vessels. So the blood that supplies the foot, that once you get decreased blood supply, that means not enough oxygen, not enough nutrients, then it starts to die off. And then the high level of sugars in the blood is also a medium for culture of, when I say for bacteria to grow and so that happens, and also destroys the nerve. So sometimes it starts that people are not able to feel things. So we call it diabetic neuropathy. Sometimes they develop. So sometimes they can even get a cut on their foot and will not even realize because it's not painful.
Yeah.
Because the sensation to that area has been reduced. And so they go and then it gets worse. And usually, if it's not well taken, it has to lead to amputation in most cases. And that's the most glaring. And that's what you tend to see at the long run, especially if you don't have good control of diabetes. So there are myriad of things that we can talk about in terms of the complications of diabetes, but it's important to also focus on the risk factors, because it's always important to catch it early. Once you catch it early, you control the blood sugars, then it decreases your risk to progressing into more complicated forms of the diabetes. And so the important thing is that we always address the risk factors, get people screened, as Dr. Odalis have mentioned. If you are at risk of getting diabetes, especially if you have a family member who is diabetic, first degree relative is the diabetic, you should get yourself screened. And then we look at certain risk factors and lifestyle modifications that can help
Yeah.
us prevent diabetes.
This is bigger than I actually thought. I want us to take a break. When we are back from the break, we delve into more. Stay tuned.
Growing up, it was so difficult finding answers to all the questions that bothered my young mind. As soon as I found my purpose and understood my mandate, I made it a mission to answer as many questions as possible, bothering young people. I have mentored, inspired, and helped young people unearth their potentials through the Martha Inspires Foundation. However, I feel it is time to bring the conversation much closer to you. We have you in mind, you the young person. With my team of experts, we bring to you the Reflection Show, a show that focuses on addressing issues young people face, helping them to unearth their potentials, and giving them nothing but the best avenues in helping them solve issues that they may face in their young age. Join me, Martha Inspires, every Thursday and Saturday at 8:30 p.m. on Truth TV, the Reflection Show, restoring hopes.
Welcome back from the break. We're still here looking at diabetes, and for me, I'm relearning everything about diabetes, and it's also reminding me that one of these days I have to go and screen and make sure that I am safe from diabetes. But there are so many myths and misconceptions about diabetes, so we want to look at that now. Dr. Abdul, what are some of the myths and misconceptions about diabetes?
So when it comes to diabetes and myth, there are so many that I can talk about, but I want to touch on two. And the one thing that has to do with that is that once you have diabetes, you take the medication, it goes away.
Okay.
You stop taking the medications. So it's just like you're treating
Malaria.
Yes, but you have to understand that diabetes is a chronic condition. And it will last lifelong, right? So there's a need to adhere to medications. So it doesn't just go away by taking the medications. The medications are to help control the blood sugars so that you don't get the complications of diabetes.
Yeah.
And so that's the role of medications. So it's not just like you're treating any other condition, malaria, you just take the medication, it goes away, right? Another one is that when you have diabetes, you don't eat sugar again. In fact, you just stop eating.
You just
I mean,
stop.
it's common in some people, and some people go the long way of starving themselves.
Of
But
sugar.
that's not the case. All right, it has, especially the dietitians and the nutritionists are experts in doing this. So in terms of food intake in diabetes or food lifestyle, when it comes to lifestyle modification, especially targeted to diabetes, when it comes to diet, the dietitians come out with what we call a diet plan, and that's to manage lifestyle. I mean the diabetes, and that alone is a strong
Yeah.
factor to reduce the blood
Yeah.
sugars. And so they don't just take away all your food, right? They modify the food at certain levels, right?
Yeah.
That are normal or that will be appreciated by the body and help reduce the sugars. And those foods they even are even more nutritious, right? And they also sometimes ask you to patronize the locally made food in the other than the canned food and refined
So
food,
more
which
vegetables.
vegetables you can talk about vegetables. We can say even
Fruits.
fruits very good. And then even when you talk about the cereals, we eat the whole grain ones because those ones are more nutritious and have a low glycemic index. So these are the common things that you would see when you're talking about diabetes in the med. So it's just very important that you don't starve yourself because you think you have diabetes. But
And
then,
some would even advise you to use even honey for tea or whatever instead of using sugar. But I have tasted some honey and
Yes.
It's a different type of sugar, but
oh, it's a different type of sugar.
different type.
Oh,
Yes,
okay.
but it's
The only thing is that honey is healthier than the common
Sugar.
sugar.
Okay.
So sometimes you, depending on the blood sugar control, then you can advise the patients to add to a little of honey to the tea, or so it can change the taste of the drink, and at the same time it's not going to affect the level of blood
I
sugar.
think I've never
too
tried
much.
honey with tea. I think one of these days I should.
you
have
should,
to.
you should. So she's a tea expert when it comes to. I remember the first time I took tea, she taught me a combination of tea with honey, tea, and lime. It
Oh,
tasted so nice. So
nice.
she's a tea expert. You
Hey,
should
I'll come
listen.
for some lessons. Let's look at some lifestyle, modifications and aftercare. After you have been diagnosed, what do you do? And does it change your lifestyle and everything?
Okay, when you are diagnosed, it's something very important is to listen to the caregiver. I always say that there should be a negotiation with your doctor or the physician who is attending to you about some changes because for some people it's very challenging to realize, oh, I have diabetes. But if you follow the instructions that your caregiver is giving you, then it's quite easy sometimes to manage the diabetes. One of the instructions during the counseling, the first thing that we talk about is, as Dr. Momi mentioned, the lifestyle modification. But lifestyle is not only about what you eat, but also the exercises that you can practice. Because we are preventing the chronic complications to present for presenting early. So that is part of lifestyle. Then will be exercises plus your diet. Then we at the clinic we have a diabetes clinic at TTH,
Okay.
also at West Hospital, Tamale Regional Hospital, and then there we have a nutritionist and dietitian expert that we instruct the patients. We recommend the patients to go and sit with them, and then they will have a good understanding of what they are going to eat. It's not like you shouldn't eat this, don't eat this, don't. No, it's just to regulate the amount. We call
Yeah.
it how do you can portion your plate, and you are good to go. Then another important aspect is the medications.
Okay.
So we also educate the patients about the medications, how to take the medication, whether oral or the injections. But something really, really important is to educate about the signs of hypoglycemia. I mean, yeah, diabetes is the blood sugar levels are high, but sometimes if you are not eating well and you are taking the medication, then you can go into hypo.
Yeah.
If the doses of the medications are too high for you, then you can go into low blood sugar, and that is also very dangerous because the patient can go into coma, and if you are not fast in taking care of the patient can die because of that. So we educate our patients about the signs, the symptoms of low blood sugar level.
okay.
And the patient can feel extremely hungry, or the patient can feel nervousness, or like the patient is shaking,
Shaking, yeah.
or even they can faint.
Mm.
So the patient can faint because of high glucose
Mm.
level. But if the patient faints and is a diabetic, believe first that it's a hypo, not hyper. Okay? Anyway, it's an emergency. So we have to, the
Right.
family have to rush the patient to the nearest health facility for us to
Yeah.
take care of her.
Yeah.
So it's not only about the treatment, but also the side effects of the
the side,
medication,
okay.
and that important uh, symptom that is a hypoglycemia. It's something that we need to look at.
Okay.
Yeah, and also she said a lot of almost everything, right? I think I've been mentioning lifestyle
Lifestyle,
modification, but then it's important to note other forms of lifestyle modification, right? So she mentioned diet is very important, then exercise, all right? So we mentioned sedentary lifestyle. So those who sit down for a very long time at workspaces, so you can think about accountants, people in the corporate spaces who sit down for a very long time at one place.
Yeah.
There's a risk of diabetes. So you need to consciously make an
So,
effort.
like sitting in your chair, working with your laptop
Yes.
and all that,
Yes.
it's a risk.
It's a
It's
risk.
a risk.
It's
So
a
you
risk.
need to at least work 20 minutes, 30 minutes,
Walk-
stand and walk,
walk
around,
around,
and
right?
then continue working, but not all the time, continuous hours working.
Wow.
Because also it's very stressful for
True.
for
Yes.
our body,
True.
and then can predispose not only to diabetes but any other chronic
Yeah.
chronic condition.
Yes.
So
Yeah, and so you mentioned obesity, so you have to think about weight loss. All right, so those who are overweight or obese have to also think about weight loss. Another thing is smoking. Smoking also has a strong risk to diabetes. So if you are smoking, also have to make a conscious effort to at least bring yourself to cessation. So stop the smoking, alcohol. You can think about a lot of these things. So you need to consciously make an effort to reduce all those things. And by reducing all those personal lifestyle that are at a risk, then you reduces your risk of.
Yeah.
All right, and also that also is therapeutic because lifestyle modification has also been proven to that even if you're diabetic or you're in the form of pre-diabetes, it reduces your blood sugars and also reduces your chances of developing diabetes. So it's very important to adhere to all these things she's talking about. All right. And then another thing I would like to touch on top of the adherence is that for those who have been diagnosed with diabetes, it's not the end of the life.
Yeah.
It's not the end. I know it's a bit challenging. It's difficult because then you have to always watch what you eat. You have to be very cautious of what you do and all those things. But I encourage you to also make the effort so that you don't develop these complications. Because once you develop the complications, it makes it more even
Difficult, yeah.
And so there are a lot of people who are living with diabetes and they are living a normal life.
And you might never even know until they tell you.
yeah, exactly.
Healthy, right? So I encourage all those who have been diagnosed with diabetes, please make the effort of what once you have been given medications, you've been given review dates, please make the conscious effort to come back. Let us see, because let's adjust the doses of our medication. Because once we come, we also look at it, see the medications we are giving, is it helping you?
Yeah.
All right. At the doses that we are giving you, are the blood sugars well controlled, or is it even on the low side and we need to reduce it? So all these changes are made when we come for review. So please always come for review. Once you have been diagnosed with diabetes, adhere to the medications.
Yeah.
Once you have any problem with any other medication, feel free. Sometimes I encourage patients to ask more. Ask your physician, ask the nurse. Ask questions. How do I take this medication, right? What are the side effects of the medication? It's very important. If you don't
And I
understand
think it's
anything,
important to ask of side effects of
Yes.
medications because sometimes we just take it and then we don't know.
Yeah.
Exactly.
Our doctors may not know that we are probably taking other medications.
yeah.
Because I'm told that sometimes there are some medications that shouldn't be taken while you are taking another kind of medications.
Yes. Yeah.
And sometimes I feel that this can also be some of the causes for one, other chronic diseases developing, two, quote and unquote, like you just be there and they are like sudden death. Because people might not know that maybe this medications I'm taking with this one at the same time may, have
compound.
some contradictions and all that.
It's very important. One of our points in coming to your program is to first to continue creating awareness,
Awareness.
about the condition. It's not for people to be scared.
Scared.
Mhm. It's not for them to be scared, but to know that there is this condition that we can suffer from, and we have everything in place. So we have guidelines, we have protocols, we are educating our healthcare providers, we are training, we are trying to expand the services to the lowest level in the chain of the ministry. Then we want to get to everyone who is at risk. We want to educate them about the importance of screening. If they hear that, oh, in my community they are doing screening, let me go. Then maybe I have I'm reassured that I don't have the diabetes, I don't have hypertension. But if I have, we have the clinics setting, as I mentioned before, and we refer those patients to start with the treatment protocols, or maybe the patient from the beginning just need to reduce their weight a little bit, then the amount of medication will be minimal.
I
So
think
it's
ladies now wants to add a lot of weight, in our body, at our back. So we want our weight to be added so that we look very beautiful and attract the men. So maybe for those who are doing that, I think that this is a time for you to know that you are at risk of getting diabetes.
Yes.
Yeah.
Yes.
So your final words about everything we have spoken about. Tidbits, keynotes we have to take away about diabetes. Let me start with you.
Okay, so my take home is diabetes is a chronic condition. Let's get ourselves screened. If you're at risk, we have spoken a myriad of risk factors, but if you're at risk, please get yourself screened. All right, let's know the signs of diabetes, as we mentioned. It's important to also be abreast with the possible complications. All right, so my take home message is that let's prevent diabetes in the first place. All right, let's eat healthy. Let's exercise, avoid smoking, all right? Then let's avoid drinking or cut down on that, all right? And then just live healthy lifestyles. So once you're diagnosed of diabetes, just please consider the possible long-term complications and then adhere to your medications. It's also important to also always come for review at the prescribed dates, and so that we can review your medications and then adjust them accordingly. All right, so let's live healthy lifestyles, and that's the most important thing.
Okay. A final words.
Well, Mumi has said it all, but I would say that prevention is better than cure. So though sometimes we can't avoid being diabetic because of many risk factors that we have mentioned, but at least if we are stable our blood sugar is stable, if we follow the instruction, if we monitor the blood sugar in the house, because we can monitor the blood sugar in the house and we know, this level is risky for me, then we are in the safer place to take care of ourselves.
Okay.
And then for the general population, be aware of that there are different health facilities that can help you
with that.
you
Especially TTH. So when they come to
especially
TTH,
if
they
you
can
come to the
get...
diabetes clinic, we are there.
Yeah.
And we are the best.
Hey, they are there and they are the best. Thank you so much for coming. We have been looking at diabetes and how we can all stay safe and take care of ourselves. I have been speaking with Dr. Abdulmumin Chelteba. He's a medical officer at the Tamale Teaching Hospital, and Dr. Odalis Rivera. She is a physician consultant also at the Tamale Teaching Hospital. So if you are, once you get to the diabetes clinic, just ask of them. Tell them you saw them on TV. So they should give you some special attention. We need to stay safe and stay healthy, and make sure that don't be scared, don't be afraid. Our healthcare systems can be trusted. I know sometimes we are a bit scared about all that, but don't worry. At the Tamale Teaching Hospital here in Tamale, we have the best doctors that you can ever find, especially if you want to get a consultant for diabetes and all that. Dr. Odalis is the best. And of course, Dr. Mumin is there to help you. Thank you so much for watching. I am Martha Spice. Do have a good night.